everyone, I am Sibisha Navaratna. Hope you all safe and adapt to online studies and also go through with our med diaries. In this video, I am going to describe about the root of the neck under the session of the head and neck. Under the root of the neck, we have to know about the key muscle of the region and also the relations between the key muscle and the anatomical structures and also some clinical significance. Let's move on to the topic. The root of the neck. It's also known as thoracic outlet. If it is anatomical region, we have to define the boundary. So, from posterior to anterior, the T1 vertebra, first pair of ribs and their cartilages, manubrium of the sternum. It's the boundary of the root of the neck. Then, the key muscle of the root of the neck is scalenus anterior. In this picture, you can see the scalenus muscles. The red color one is scalenus anterior. It is a flat muscle originated from anterior tubercle of 4 typical cervical vertebrae. It runs forward, laterally, downwards and becoming narrow towards the insertion. You can see here it's narrowing towards the insertion. It's inserted on scalene tubercle and inner border upper surface of the first rib. The muscle is innervated by anterior rami of C4 to C6 nerve branch. It's mainly important for landmark, but also it assists flexion and rotation of the neck. Okay, let's move on anterior relation. First, we look on phrenic nerve. The phrenic nerve runs vertically downwards in oblique manner and it's plastered by prevertebral fascia. You can see here nerve is under the fascia and also the pad of fat in front of that. It leaves the medial border of the scalenus anterior in front of subclavian artery and internal thoracic branch behind the subclavian vein. But there is a possibility to pass the subclavian vein anteriorly, or it may pass posterior to the internal thoracic artery. Then it lies on suprapleural membrane and runs medial to the apex of the lung, crossing in front of the vagus and enter the superior mediastinum. Further course, of course, we have studied in thorax. Second one is ascending cervical artery. In this picture, you can see left ascending cervical artery. This artery is the branch of inferior thyroid artery. The inferior thyroid artery is from thyrocervical trunk. The ascending cervical artery runs up on prevertebral fascia, medial to the phrenic nerve. Then, the third and fourth one are superficial cervical artery, suprascapular artery. You can see here, these two arteries run in front of the prevertebral fascia, between scalenus anterior behind and carotid sheath front. Here, there are 3 arteries branching from the first part of subclavian artery. One of the arteries is thyrocervical trunk. The branches of the thyrocervical trunks are inferior thyroid artery, superficial cervical artery, suprascapular artery. Then the vagus. Vagus runs medial surface of the apex of the lung and enter the superior mediastinum. Another one is internal jugular vein. Internal jugular vein has inferior deep cervical lymph nodes adjacent to that. Here we are able to see inferior deep cervical lymph nodes adjacent to internal jugular vein. Then the other one is subclavian vein. Subclavian vein lies in the groove on first rib. It lies anterior to the insertion of scalenus anterior and lower level than the scalenus anterior due to the position of the first rib with angulation. And then they join internal jugular vein to form a brachiocephalic vein. In the angulation between internal jugular vein and subclavian vein, the thoracic duct in the left side, right lymphatic duct in the right side drain the lymph. When we talk about the clinical significance, we have to mention about the catheterization. In many operations, right subclavian vein can be used for the placement of the central venous line instead of the internal jugular vein because it's more comfortable for the patient. The usual approach of the vein is infraclavicular from a point 2 cm below the midpoint of the clavicle and passes behind the clavicle towards the jugular notch. There are two complications of this procedure. First one is puncture of the subclavian artery. Even though subclavian artery is separated from the subclavian vein by the scalenus anterior, it can be punctured. The second one is puncture of the pleura. It causes pneumothorax. You all know about the complication of the pneumothorax. The second clinical significance is subclavian vein is used to placement of wires from the cardiac pacemaker. They are implanted in connective tissue over upper lateral part of pec major. Let's move on medial relation. Here we have to look on pyramidal space and subclavian artery. First, the pyramidal space. Let's demark the boundary. Medially, the lower lateral border of longus colli. Laterally, the medial border of scalenus anterior. You can see here, there is no fascial covering as a roof. The both muscle, the scalenus anterior and longus colli are covered by prevertebral fascia, but the space is not covered by fascia. Then the base. The base is subclavian artery and the apex is carotid tubercle on transverse process of celiac vertebrae. Immediately in front of the pyramidal space, there is carotid artery. Between carotid artery and the pyramidal space, there are inferior cervical sympathetic ganglion with vertebral artery and vein. In cross section of the neck, we can say most posteriorly there is pyramidal space and anteriorly there are inferior cervical sympathetic ganglion with vertebral artery and vein, and most anteriorly there is carotid artery with carotid sheath. Then the inferior thyroid artery. We all know it's a branch of thyrocervical trunk. The inferior thyroid artery arches medially in bold curve, and upper convexity of the curve is in front of apex of pyramidal space. At lower level, thoracic duct makes similar convexity and into the confluence of subclavian vein and internal jugular vein. The second one is subclavian artery. The scalenus anterior descriptively divide the subclavian artery into three parts. First part, second part, third part. Now we are looking on medial relation. So here we have to talk about the first part of the subclavian artery, which is medial to the scalenus anterior. It arches over the suprapleural membrane, we all know the suprapleural membrane, and make a groove over the apex of the lung. Then the first part have three branches. First one is vertebral artery, second one is thyrocervical trunk, third one is internal thoracic artery. The most medial branch is vertebral artery. It passes up to disappear at the apex of the pyramidal space and enter into the foramen of transverse process of C6 vertebra. The second one is thyrocervical trunk. It's lateral to the vertebral artery. It divides immediately into superficial cervical artery, suprascapular artery, inferior thyroid artery. The proximal part of the superficial cervical artery, known as transverse cervical artery, when only it gives off the dorsal scapular artery. If it is give off the dorsal scapular artery only, we can say the proximal part of the superficial cervical artery as transverse cervical artery, because dorsal scapular artery may be from third part of the subclavian artery. Then the third one, internal thoracic artery. It's from the lower surface of the subclavian artery and runs over the lung apex. It's crossed usually anteriorly by the phrenic nerve. Here we have to mention about ansa subclavia, right recurrent laryngeal nerve, and also the vertebral vein. The ansa subclavia is a connecting loop between middle and inferior cervical ganglia, which passes in front of first part of subclavian artery. Then the right recurrent laryngeal nerve is a branch of vagus and hook around the artery, exactly the first part of the artery. The left one, as we all know, which hook around the ligamentum arteriosum. Then the vertebral vein. They emerge from foramen in the transverse process of C6 vertebra and run forward in front of vertebral and subclavian arteries to drain into brachiocephalic vein. Let's move on posterior relation. Here we have to know about the scalenus medius and second part of the subclavian artery. In this picture, the scalenus muscles are labeled in different colors. The green color one is scalenus medius. The scalenus medius is separated from scalenus anterior by subclavian artery and anterior rami of lower cervical and first thoracic nerve. The second one is second part of the subclavian artery. Second part has only one branch known as
costocervical trunk. The costocervical trunk divided into ascending and descending branch. The ascending branch is deep cervical artery. The descending branch is intercostal artery. The intercostal artery enters the thorax across neck of first rib. We all know the relationship between intercostal artery, this intercostal artery, and other nerves and veins. We have studied in thorax. The lateral relation. The first one is trunk of brachial plexus. The second one is third part of the subclavian artery. We have to mention these two structures here. Both are behind the prevertebral fascia on the floor of the posterior triangle. The third part of the subclavian artery have a branch known as dorsal scapular artery. The dorsal scapular artery contribute in scapular anastomosis also. Earlier we have seen there is a possibility of the dorsal scapular artery coming from superficial cervical artery. If it is coming from superficial cervical artery, the proximal part of the superficial cervical artery is known as transverse cervical artery. Okay, according to this one, we can remember the branches of the subclavian artery like vitamin CD, VIT-CD. V for vertebral artery, I for internal thoracic artery, T for thyrocervical trunk, C for costocervical trunk, D for dorsal scapular artery. We can remember like this. The surface marking of subclavian artery. From the sternoclavicular joint, the artery arches upward to the middle of the clavicle and about 2 cm above it. This is the surface marking of the subclavian artery. We will see something about scalenus medius and scalenus posterior muscles. The scalenus medius originated from lateral end of transverse process of atlas and axis and other posterior tubercles of all other cervical vertebrae. We all know the insertion of the scalenus medius, which is in first rib between neck and subclavian groove. The scalenus posterior originated from posterior tubercle of lower cervical vertebrae and inserted into second rib. Both muscles are supplied segmentally by anterior rami of cervical nerve. The actions. Scalenus medius mainly a lateral flexor of the neck and also it is inserted in first rib. Due to that, it can be an accessory muscle of respiration.
That's all about the root of the neck. I have covered some important points on the topic. Hope you all get some idea on the topic. Thanks for watching my video and don't miss to subscribe and share the videos. Keep following our med diaries.